An organization representing the rights of inmates is accusing the Department of Correctional Services of not being honest about the number of inmates who have died as a result of COVID-19. For more on this, let's cross live to our reporter Patricia Visagie, who's live for us at the Kgosi Mampuru Correctional Services in Pretoria. Patricia, very good morning to you. What are you learning?
Good morning, Blaine, and to our viewers. Certainly, we're coming to you live from one of the biggest correctional services facilities in the country. Of course, the Kgosi Mampuru Correctional Services facility within the heart of the capital city. And as you have rightfully put, of course, you know, the country being gripped by the impact of the COVID-19 pandemic. So are inmates also affected? And as you've mentioned there, that organization, of course, SASAPU, that is representing the rights of inmates, saying that the department seems to be disingenuous about the number of inmates who have succumbed as a result of COVID-19. Of course, they bring also other string of concerns that they're laying bare, and some of these issues are actually old issues. It's issues that we have heard of repeatedly, of course, over the years, and that is the issue of parole. But right now, the focus lies squarely on the impact of COVID-19 within our correctional services facilities and how, of course, the rights of inmates are actually respected as it is enshrined in the country as a constitution. And this organization, SASAPU, you can see he's the spokesperson, or rather the chairman here, of course, Mr. Phindile Zweni, standing by, and we'll just get word from him correctly now as to, you know, from what point are they coming from. And we also have the spokesperson, of course, for both the Departments of Correctional Services and Justice, who will be responding to some of these allegations and really bringing us into the picture in terms of what is really happening. So let's get straight into it and find out what exactly is SASAPU complaining about and what action are they planning to take. Thank you so much for joining us, Mr. Phindile Zweni. In short, you are unhappy with a whole lot of issues, but you are concerned about the effect of COVID-19, and you're saying that many inmates have died and the real number is not reflected. Can you please bring us into the picture?
Yeah, correct. Yes, our concern as SASAPU, as an organization, is very simple. That presently, we all know that the prison is overcrowded with many, in fact, about 75%. And there are many cases of people dying in prison. The correct number of the people that has died in prison is actually not what has been cascaded or brought to the attention of the media. We have got direct contact with family members of inmates, and they come directly to us. We are saying to the department, and we are asking the department, what is happening within, especially the people that are sentenced to life imprisonment. There is 3 judgments that were issued by the high courts, which stated properly and stated that certain inmates falling into certain categories should be released. Now, there are stages where these people should, files of these people should be sent to the minister's office. That has been now, as we speak, with the minister's office. Those files are still there for the last years, 2 years, up to 3 years. And it's just awaiting for the signature of the minister to sign and then those people to be released. Now, the minister himself went on media and said that these people will receive first priority. And then we've got the people that are chronically also awaiting for them to be released. Those people are still languishing in prison. There are cases where people have died because of that. Then you've got the babies, mothers with babies in certain centers. Those people are still there languishing in prison. During this COVID-19 period, the first person of fatality happened at West Bank in East London, where an elderly woman of 63 years succumbed to the COVID-19 disease. We as SASAPU went to Butterworth to show our condolences. Nowhere were DCS to be seen on that specific day. Up until today, we've got a couple of people that are complaining, family members that are complaining that their loved ones has died in prison. Nothing has been done by the DCS. We are asking that we're not saying open the floodlights, open the gates for everybody to come out. What you are saying, those cases for the lifers that we are talking about is people that are eligible for parole, have completed, have done all the programs, including VOD, they should be released. Chronically ill people should be released. They've served half or three-quarters of their sentences. They should be released. Mothers with babies who have served their time should be released. Then you've got awaiting trial prisoners or inmates who are sitting and languishing in prison for the last 7 years. Those people are not brought before court. And now during the COVID-19, there is no court sittings. Bail applications. Why don't you give these people bail? Release them, because some of them are found not guilty in a court of law after 7 years. What have you done to that person? We are saying, we are asking the minister to look at these things so that, and the NPO should be brought into the picture to talk with us so that these cases should be expedited. Now we are saying that, and we are not threatening anybody. We are saying, should the minister not respond within 7 days of date hereof, we are going back to the court so that we can find relief for these people that we have mentioned.
Now with COVID-19, of course, gripping the country, the infection rate is really increasing daily. How do you link your call to this reality, the fact that you feel that these inmates should be released, and of course the correct number, as you have alleged, needs to be reflected to society? How do you link that to the increasing COVID-19 cases in the country?
Well, it's very difficult to explain to you what effect has that got, in fact, on the families of the incarcerated inmates. It's difficult to explain to them. I just feel that for them it's a death sentence. It's already a death sentence for them to be sitting there waiting to die anytime. Because of the overcrowded, I'm not blaming the Department of Correctional Services for overcrowding in prison. There's many stakeholders that we should look at. There's many other challenges that we should look at. But we are saying that those people that are eligible for parole should actually be released. There is a lot of people that are eligible. They should be released so that they can go outside and get the necessary treatment. Because, one, there is no health care in hospitals as we speak because of the COVID-19 pandemic. There's no nurses in hospital. There's no doctors in hospital. Only a few of them.
Are you talking about the prison hospitals now?
That's prison hospital. There is no nurses, enough nurses to take care of these people. There's not enough doctors to take care of these people. We've got some department or prison heads that are doing their best. However, they are also working under enormous stress. So we are saying to government or to the department, make something, involve stakeholders so that we can tackle this pandemic together.
And you feel that by releasing some of these inmates, it might dent the impact of COVID-19 in the prisons. Do I understand you correctly?
Correct. That's correct. Release those people that should have been released a long time ago. We're not saying release everybody. There are inmates that are eligible for parole and release. Release those people. Look at the system of the awaiting trialists. Talk to the NPA. Let these people go to bail, to courts. Get bail for these people. Let them get bail and be released. Because every day, as we speak, there's a lot of incoming inmates coming in to the prison. So how are you going to alleviate the overcrowding if the situation is like this? 19,000 should have been released within 3 months. It was what the minister and the president said.
And it speaks to the issue of social distancing, which we know is so important in the fight against COVID-19.
Exactly. It's a violation of the human rights of, if you can call it that. It's a violation of the human rights of the inmates. Because social distancing is very important. That's not happening. 3-4 inmates are sleeping on one bed. So how on earth can you have such a situation in correctional centers? That is impossible.
All right, thank you so much. We'll come back to you just now. Let's turn our attention to, of course, the department, the spokesperson for both departments, of course, Department of Justice and Department of Correctional Services, Mr. Crispin Phiri, here standing by to respond to some of course, the demands made by SASAPU and some of the allegations that Mr. Zweni have, of course, just tabled there and some of the concerns. Thank you so much for joining us. Let's get to perhaps the highlight right now, the issue of concern, the numbers. You hear SASAPU here saying that you are not being honest in terms of how many inmates have died. You are being disingenuous. Can you respond to that and just tell us from Correctional Services side, how many inmates do you know of that have died of COVID-19? What are the numbers looking like at this stage?
Yeah, thank you very much, Patricia, for the opportunity. And just to say that I'm not responding to the demands. I think they will table their demands formally and we will take it from there. To date, we have actually more officials contracting COVID-19 than inmates. And we really do want to commend the officials who come to these facilities and put their lives on the line and try and serve the nation. As we speak currently, we have 1,292 officials who have contracted the virus, active cases. Overall, it's about 5,000. And then in terms of inmates, we're literally sitting with approximately 100 and something inmates, active cases in the facilities currently. And this shows you that we actually have been able to contain the pandemic quite well in these facilities. The recovery rate of offenders sits at about 74%, which is significantly high. And we must recall that the population in total of correctional facilities is approximately 161,000. So if you look at these numbers, it tells you that there's something right that we are doing in our correctional facilities to contain this pandemic. And then over and above that, if you look at the number of deaths, when these are regrettable, we only have approximately 73. And we once again do send our condolences to those family members who have lost their loved ones. But it's important to demand from organizations like SASPO and everyone in society that if you're going to level a claim, put facts forward. So if you say that we are misrepresenting the numbers, then what are the real numbers? And show that evidence so that we can have a concrete conversation. I think it's very easy to say that the numbers are being misrepresented and then you don't put forward what you think the real numbers are, if there is such a thing. And I think this is a culture that we must normalize in our societies, that when people say the facts that are before you are not relevant or are not true, we must place the burden on them to produce what they deem to be the real facts. Another allegation that was made today was that there aren't enough health officials in the facilities. But if you look at the numbers that I've just given you now, the 74% recovery rate, the number of officials who are contracting the virus, yes, it has an impact on how we provide services as a department. But it shows you that the protocols that we have in place are definitely working. And I think that is the premise that we must always depart from.
Okay, just because we have about 5 minutes left, I just need you to give us a summary. You heard some of the other complaints, of course, going back to the rights of inmates to be released on parole, those who are eligible. Just in short, of course, as you said, they need to table their demands. But if you can maybe just, inform society how that process works and why, when perhaps an inmate is eligible for parole, do they not necessarily get that privilege, although we say it's a right, but there are so many other aspects that need to be considered, right, so that we can get to that point. Just bring us into speed.
No, that's absolutely correct. Parole is a privilege, and it is conditional depending on your behavior in the facility and whether you've undergone rehabilitation programs. One of the people that he wants to be released are what we call lifers, and maybe we should spell out what lifers are. These are people who have committed murder, rape, very serious crimes in our communities. And ideally, you don't want such people being let out willy-nilly without a very due process. And there is a very strict process that those people are released on. It's a process that goes through the National Correctional Services Council. They then process those applications and then give them to the minister. And the minister signs a significant number of those paroles daily. That's something that the minister is on record saying. And really, we do need to make sure that such individuals do not benefit necessarily from a process that is not intended for them to benefit from. There is a due process that they are supposed to benefit from. The COVID-19 special parole dispensation was for individuals that firstly have been identified as low risk. So these are people that we can explain to the community that this individual, yes, has committed a crime, but if you look at the totality of the crime, it is not one that has caused an extent of great grievous bodily harm or a great harm to the community. It has caused harm, and this individual is remorseful. And they still then undergo a parole process. But even that parole process, I just want to speak to why it's been delayed, is that
I think we just need to quickly wrap up. We need to get one last question into, just make it brief.
Even that parole process has been delayed because COVID-19 is in our communities. And some of these people that sit on our parole boards are members of the community. So they too have been affected by COVID. So COVID has been really disruptive to the entire parole system.
So everybody is affected by COVID. We understand that. Just bring us into the picture. Does the prison system have enough PPEs to, of course, make sure that the rights of inmates is preserved in terms of that?
One of the most significant things that the minister has instituted when we found ourselves in the COVID pandemic was that facilities must manufacture their own masks. If you look around, if you've seen a couple of offenders, most of them are wearing masks. Those masks are manufactured by offenders themselves.
Do you have enough? Do you have enough?
We definitely do have PPE equipment, and we have a system that is able to manage the PPEs across the board.
But you haven't answered. Do you have enough? Is everybody catered for as supposed to be?
I'm saying we have a system that caters for PPEs, and it is there. So some facilities will run out. There's a system where we are able to replenish that. So the point is there's a system in place.
All right, thank you so much. Just lastly, you heard Mr. Phiri here saying that you have not actually presented the right facts to support your allegations of the number of inmates who may have died of COVID-19. What do you bring to the fore to support that allegation?
Well, I didn't expect that from Mr. Phiri. However, I think in our next debate we will bring that figures together. We will definitely bring it.
But what have you been told? What if there's not a next debate? You came here, you're the one who approached us. What are you presenting to prove what you're saying?
We have proof. We have proof that,
What are the numbers?
The numbers that we've got of people that have died in prison is almost at 55 nationally.
But he just said it's about 75. So where then?
Sorry, it is 77 that we've got. Sorry, 77 inmates that have died in prison.
But then, if he's saying 75 and you're saying 77, then is there really a lie?
No, it could be the correct figure. I can imagine that we also are sitting with figures that we get from family members, and it's normal. And honestly, it's actually the right figure.
Are you not just instigating and inciting with misinformation, wrong information, and perhaps not giving the clear picture here?
Not at all. We as a SAP have been working closely, and we've been trying to work closely with the Office of the Minister, with the National Commissioner. We've at all times have worked together with them. It's the department that does not come back to us. It's not us. We are working closely with them. We try to work closely with them, but they are ignoring us. So we are not inciting anything at all. However, we're trying to work together with the department.
Are you not using the COVID-19 pandemic to actually push for your real cry, your real demand, and that is for the inmates to be released, and you're piggybacking on the COVID-19 pandemic?
Not at all. Not at all. We have been here before the COVID-19 pandemic. We have been here, and we've been speaking to the Department of Correctional even before that. And we've been telling them of certain things they didn't know of. So in other words, we are working closely with them. They are the people that doesn't want to work with us. We are working closely with the department. Even Mr. Phiri has said now in this interview that he would like to work with stakeholders like us. So, but we don't get any response from these offers.
But it's wrong for us to get wrong information and run to the media. You just came with information and you can't back it up. I'm concerned.
Yes, I'm going to back this up. I'm going to back it up, definitely. Definitely, I'm going to send it, and I'm going to send it to the media, the correct numbers. And I'd also like them to come up with proof of what they are saying.
I'll have to leave it there, but I think you owe society that correct figures. You also owe the media that, of course, statistics, so that we just get to the bottom of what is really happening here. Is the department concealing some information, or is SASAP perhaps just being opportunistic and they're trying to use the COVID-19 pandemic to push their real agenda, and that is for certain inmates to be released on parole. And you heard the department, of course, just laying out what exactly the conditions are that inmates need to fulfill, or rather meet, before they can actually be reintegrated into society. So it's not an easy thing, because the victims, the families of the victims' feelings and so forth, and their inputs need to be strongly considered. And of course, that element of fully being rehabilitated, showing remorse. So it's really a very intense and complicated process. It's not as easily put as may sound. And we've heard many people in society, of course, also complaining about this, saying that people who have raped and murdered cannot be given that lenience. But as well, we are a constitutional democracy. So the Constitution also does provide for the inmates to be protected, for offenders to, of course, be considered within the ambit of the country's Constitution and a Bill of Rights. So we'll have to really dig deeper and find out what is really happening here. But just to highlight, it is really concerning that SASAPU is failing to really back up their claims with the right statistics. But just to give you just another wide shot of what's happening here, there you see some of the prison warders, you see the inmates here at the Kgosi Mampuru Correctional Facility, and just shortly you saw those visuals of one of the inmates who was just taken out, and he seems like he is ill and maybe perhaps linked to COVID-19. We're not sure exactly what is happening there, but it seems like so far everything is under control from where we're standing. But we really do not know what is the real story behind these bars, behind these walls. And that is the story, that real story, that we are interested in. Thank you for watching. It's back to you in studio.
Yeah, Patricia, we appreciate you trying to get to the bottom of this story. Patricia Visagie, live for us in Pretoria. Thank you. All right, let's take a quick break. I'll get you more news.